Corey. We're back to share our Whiteboard Wednesday series with you. I'm joined by Dr. Rick to discuss a very important topic.
Hello. April is Oral Cancer Awareness Month. Instead of dedicating this video to all oral cancer, we're going to be primarily focusing on the HPV virus.
While there are many things that can increase your risk of getting oral cancer, in the recent years, there has been a connection between two different diseases. Let's start with the basics though. What is HPV? What exactly is it?
So HPV stands for human papillomavirus. It's a makeup of more than 150 different types of viruses. It gets its name because primarily the symptoms that occur are a wart or a papilloma. While a virus can lead to very serious issues, most humans will come in contact with the virus sometime in their lifetime.
Some doctors even consider it as common as a cold. Like we said, there are many different types of the virus, and each type is assigned a number.
Though a lot of parts of the body can be infected by HPV, there's only one specific strain that so far has been linked to oral cancer, and that's HPV-16 virus. So outside of the HPV-16 virus, there are many other types of viruses that are found in the oral cavity. All of this may change in the future as more research is done.
There are both high-risk and low-risk variations of the virus. HPV-16 is considered high-risk, and that is the one that is directly linked to the oral cancer. HPV-18 is also considered high-risk. 16 and 18 are both linked to cervical cancer.
In many cases, the body's own immune system is able to fight off the infection, but the body is not always able to do that. Patients who have high risk factors or chronic infection from the virus, this predisposes them to gaining or having the HPV virus turn into a cancer type of situation.
The number of oral cancers linked to the HPV virus has risen over the past few decades. And it also has become more common in young adults that have no link to alcohol use or tobacco use.
HPV DNA has actually been found in 2 out of 3 oral pharyngeal cancer cases, which is another fancy term for throat cancers. In a smaller fraction, it's found in oral cancer, so it's predominantly found in throat cancer patients.
While the reason for the rise is unclear, it is thought to be linked to changes in sexual practices over the recent decades.
You might be asking, how do I get HPV and is it preventable?
Well, HPV is passed by skin-to-skin contact, which occurs in sexual activity. Even if the person that is contacted is not showing signs or symptoms, you can still get it.
Unfortunately, because there's so many different types of the HPV virus, there's no fully guaranteed way to prevent getting the virus.
The fact is that anyone that is sexually active is at risk for the virus, even if you've only had one partner. However, there are things you can do to lower your chances of being infected.
For anyone who is sexually active, keeping your partners to a minimum is one way to minimize your risk, but unfortunately, remember, there's no fully guaranteed way to prevent fully infection.
If you are sexually active, proper condom use can lower your chances, but it does not guarantee an absolute prevention.
The HPV vaccine can help prevent most types of the common HPV. It's considered most effective in older children and younger teens, but it can be given as late as 26 years old.
The younger you are, the better it is to get the vaccine because your immune system has a better response to it. The older you get, the less likely the vaccine is to work, but it can still lower your risk of getting HPV. But if you already have HPV, getting the vaccine also can help you prevent getting different types of HPV.
So far, the vaccine has been shown to have lasting effects, but there's current research right now being done that is trying to decipher exactly how long that effectiveness lasts. In most instances, if there's a drop in the protection that vaccine gives, there's a booster that can be given that can help prolong that effectiveness. Most information about your HPV needs or vaccine needs can be addressed with your primary care physician. they'll be able to answer any types of questions you have about the vaccine or HPV. Okay. In some cases, the only sign and symptom that will show up will be warts or papillomas. If you've been diagnosed with HPV, your physician can help clarify the exact diagnosis of what type of virus you've had. In some cases, there won't be any sign or symptom that actually show up.
It's important to remember that outside of HPV, that oral cancer still occurs, and there are risk factors that increase your chances of developing oral cancer.
Some of those risk factors can be things like UV light, being outside exposed to sunlight on a consistent basis with your job or with recreation, alcohol use, tobacco use, age. There's a lot of different reasons, but those are some of the main common risk factors.
We discussed some of the risk factors more in depth in our last year's Whiteboard Wednesday for Oral Cancer Awareness Month. So if you want to know more about those risk factors, go to that last year one. Let's talk about symptoms though. For HPV, there are usually no signs or symptoms other than the cases of people experiencing warts, but oral cancer does have many signs and symptoms to look out for.
Yes, you're right. Oral cancer has a lot of different ways that it can be manifested. Some similar or common ways that we see red or white patches in the mouth that are sore, lumps or bumps that won't go away. Anything that causes the mouth to be sore that has no explainable reason and it won't go away is something that should be checked out.
The loosening of teeth or the pain around teeth, lumps or masses in the mouth, voice changes, lumps in the neck, that is all things to look for. Those are just some more signs and symptoms to look for.
So for oral cancer, regardless of whether it's related to HPV or other sources, it's important to be kept up on your regular dental visits because we can do screenings. So here at Yale House Dental, we do regular oral cancer screenings every time our patients are here for an exam. And this gives us the ability to check on a consistent basis how the tissue in the mouth is doing and if there's any signs or symptoms that are starting to manifest.
You're right. Here in our office, we use the Oral ID light to detect any type of abnormal lesion or spot in the mouth to detect oral cancer before it progresses to oral cancer. But the Oral ID light is just a screening tool. It does not diagnose. It just detects an abnormal spot in the mouth.
Yeah, so our Oral ID is a pretty cool device. The science behind it is that as we check the tissue, it will detect any type of traumatized tissue of any sort, and it'll actually show through in a darkened state. What our protocol is at that point is we take pictures of that area and we bring you back for a follow-up appointment in about 2 weeks. We recheck the area with a screening tool. If it's went away, then we can attribute that to just a traumatized area, maybe you bit your cheek or burnt the roof of your mouth. If it's still there and looks the same, then we usually get you over to see an oral surgeon to do a more in-depth testing, like a biopsy, to determine what that abnormality is.
You can ask us any questions about oral cancer. You can leave comments below, or you can visit with us at your next appointment.
And if we can't answer them, the best place to get this information is probably going to be from your primary care physician. They have a lot more information and just have a lot more experience with this stuff than we do. We do a lot of the screening, but they'll do the diagnosis and treating.
Make sure to go like, comment, and share, and join us next month for our X-Ray Safety Whiteboard Wednesday.
See ya.
Bye!